Hi everyone, my name is Amelia Martinez, and I'll be talking about a TED Talk by Dr. Rachel Wayford called Early Intervention for Psychosis, Building a Mental Health Community. She presents the importance of early intervention in young people with psychosis. She is a licensed clinical psychologist with her area of interest and specialty in early identification and intervention of individuals living with mental illness. She discusses how difficult it is for young people to seek help when they are experiencing psychotic symptoms due to the stigma and fear that's added onto it. She mentions how the news and media adds to the stigma of psychosis, where it's typically romanticized. Young people tend to not seek help until things get worse. Sometimes by then they have had a traumatic psychiatric hospitalization. Typical age of onset of psychotic symptoms happened between the age of 18 to 24 years of age, which is also a critical age of development, such as developing communication skills, problem solving, and decision making. Also during this time, most young people are involved in systems, which include areas like school, church, or any other extracurricular activities. And these are systems in where people surround these individuals on almost in a daily basis, such as professors, coaches, coworkers, friends, that can help with early intervention. These systems allow others to observe any shifts in an individual that may require psychiatric help. Dr. Wayford also uses the term for these observers as first responders because they can be the ones to first identify symptoms of early psychosis amongst their peers. She identifies that we can share information about early intervention of psychosis and provide them with trainings, such as looking for symptoms and how to speak to someone who is currently in a psychotic state. She describes these people also as agents of change, and that she hopes that as a community we can advocate for each other. She mentions how we can be helpful by educating ourselves about mental health and by also choosing our words carefully, such as not using the word psychotic and insane that can bring negative messages towards mental health. The more we talk about mental health, the more we're able to destigmatize the negativity that comes with having it, and we're able to normalize seeking help without any fear or hesitation involved. Dr. Wayford's message of advocacy and being proactive resonates with me because I have seen individuals who didn't get early care in their when they first had signs of psychosis, which then resulted in them having mandated psychiatric hospitalizations. Also, in terms of self as a therapist, being able to talk about mental health can be very challenging, especially if you take into account cultural considerations. For myself, being from a Filipino culture, tackling cultural stigmas amongst the culture, particularly my family, can be very hard. For instance, when I first told my family that I was going to pursue a career in mental health, they would say things like, "Why would you want to do that? It's not important." Or, "You'll work with the crazies then?" So things like that I hope to change in my role as an MFT. Being able to teach and promote mental health advocacy is very challenging, yet it's very important, and I hope to be able to destigmatize beliefs in my own culture. Some ethical considerations to keep in mind were briefly talked about in the TED Talk, where Dr. Wayford describes how the agents of change are not responsible to make treatment happen or to diagnose. Like in one aspect, every individual has autonomy and is able to seek help for themselves whenever they deem appropriate, and beneficence also must be taken into account to support an individual who may need care. As therapists, we must take into account severity to give appropriate and least restrictive care. Thank you.